everyone. It's Dr. Tamara Beckford with Your Caring Docs. That's right, where we're helping our busy professional women put themselves first for at least 2 hours a month. And we have our Your Caring Docs podcast, our Your Caring Docs, Docs Who Cares, right? That's when we have doctors from all over the world. They stop by and then they leave their gems. The biggest part is that they leave their info so you can get in contact with them if you'd like to be a patient or a client of theirs. This time I am taking you back to my state right here. We are in the Lone Star State, and I'm going to introduce to one of my favorite docs here, right? So bringing her in Your Caring Docs fashion. So this wonderful doc is a graduate from UT San Antonio. So all our UT people, stand up. Yes, all our Longhorns. Hello, hello, hello. All right. And she did her residency in ear, nose, and throat, otolaryngology. Yeah, we're not going to say that word throughout the entire time. So we'll just say ENT, right? And she did that at the University of Kansas School of Medicine. She is board certified in ENT, and she is an ear, nose, and throat surgeon, where she is taking care of all of our lovely people in the Arlington, Texas area as a board certified ear, nose, and throat surgeon at the Central Park ENT. Yes, welcome, welcome, welcome. One of our superstars, Dr. Dana Gibbs. Dr. Gibbs,
oh my gosh, Tamara, I love this. This is so great. It's so good to see you.
Same here. You know, I'm super, super amped that you stopped by. Because I think you're one of our first ear, nose, and throat docs, the otolaryngologist.
Oh, okay.
Yes, that's right. So you're kicking it off for all our ENT people out there. So
all right.
People were listed and they're like, wow, you know, I wonder, like, how did she get into medicine? What made her decide to go into medicine? So go ahead.
Oh my gosh. You know, my dad had ear problems when he was a young man, and I got to go to the ear doctor with him when I was like 4 or 5 years old. And so that kind of put it in my mind right away. It's like, oh, they have those cool things, and they rebuilt his eardrum, and it was just so neat. And, you know, I think I started reading books about doctors and about the history of medicine when I was maybe like 10. And I've kind of just known all along that I wanted to do. So it was a pretty natural move forward. And I never really considered doing anything else.
Wonderful. You know, this is so interesting because there are a couple of docs that I've interviewed where someone in the family, you know, there was a medical issue and it drew them to medicine. They're like, wow, how fascinating it is that my loved ones, fill in the blank of the name of that particular loved one, mom, dad, cousin, you know, had a medical issue, and I kept going. So it just kind of lends to the fact that it's so important to keep our information open to our kids and to our young ones, because at that point you are inspiring the next generation, probably without even recognizing it, right?
Well, so, if that's the case, my kid's going to be an orthopedic surgeon because I'm like the orthopedic nightmare.
Well, here we go to our future orthopedics.
Although she says, Mommy, you work too much. I would never be a doctor.
Well, we'll see about that. I think we have, like we said, some future orthopods, especially ones out there. Wonderful. So, you know, you got into, you know, this eye-opening, wow, I like what these people are doing for my dad. And these people are doctors and doctors care, and they're doing all these very cool things. So now you're in med school. Did you go into med school thinking, I want to do ENT, or were you?
Oh, no.
Tell us that.
Gosh, no. No, I had studied Harvey Cushing. He is like the father of neurosurgery. He took the first brain tumor out. He did the first successful brain tumor operation, way back in maybe like 1900 or something. I don't even remember now how old it was. But so I had this idea that I wanted to be a neurosurgeon. And, you know, really luckily for me, nobody ever said, oh, girls don't do that. Luckily, I got so lucky. Nobody ever said that. And so I went in thinking, oh yeah, I want to do something like heart surgery or brain surgery or something like that. And then, when I got to the part of medical school where you start to pick your electives, I did go and do a rotation with the heart surgeons. And I did another rotation with the orthopedic surgeons. And then I did a rotation with the trauma surgeons. Yeah. And I figured out pretty quickly that those were some of the unhappiest people in the hospital. And then I did a rotation with the ENT doctors. And it was a crazy thing because the first day on ENT, I walked into a surgery where they were taking out throat cancer from somebody's voice box. And they were, really opening this person up. You could see everything. And I was like, wow, that's really neat, and I was so into it. And then I realized, these doctors, they go home at 5 PM. They don't spend all, what I had been doing, which was 24 on, 24 off, or more like 28 on, 20 off, doing this trauma surgery, this orthopedic surgery. The ENT doctors were happy. They knew their kids. They relaxed. They joked around in the operating room. I was like, wow, yeah, this is so totally what I wanted to, this is what I want to do. Yeah. And so I got extremely lucky that I figured that out. And, I had picked ENT as one of my several rotations just because of what my dad would do. And I had my tonsils out when I was a kid. So I was kind of a little bit familiar, but mostly because of my dad.
Wow. Look at that full circle. So you open, it's like a second opening of the eye. Like, wow, this is a great specialty. And I'm getting to be with my family at the end of the day. This is awesome. So, one of the things, like you're saying, ear, nose, and throat. So for those who, that's what the otolaryngology. So if you get your paperwork and you're like, oh, Lord, they told me to see the otolaryngology is ear, nose, and throat, right? So with that, some of the things that you're taking care of are kids and adults with allergies. Oh my goodness.
Oh my gosh. Yes.
It is so much. So tell us about like all the allergies and, some of the challenges, especially that the patients are facing. And then we're going to go in and talk about the secret sauce that you have for us physicians.
Oh, okay.
First, let's talk about the patients.
Sure. So, a lot of doctors see patients year after year after year for the same colds or sinus or bronchitis or ear infections. And when you look back on it, it's happening at the same time every year. And people don't realize, okay, so allergies, people know about hay fever, the sneezing, the red eyes, the itchy nose. People know those symptoms, but they don't know these other things very well. And they go to the doctor and they think they need an antibiotic all the time, over and over again. And the truth of the matter is, when you look at the pattern, you can say, oh my gosh, it's happening at the same time every year. It's because of the pollen and the dust that's blowing around in the air, and you breathe it and your body reacts badly to it. And I think the statistics are 20% of people in the United States suffer from allergies. And so, for some people, it's just a week here and a week there. It's not that big of a deal. But for some people, it's all the time and they're miserable. And they've tried every kind of allergy medicine and even the prescription allergy medicines, and they do them every day, and it's still not enough.
Right. And
so ENT, because all of it comes in through your mouth and nose, we see more than our share of that. And so otolaryngologists, as a part of what we do, focus on allergies, and we focus on what's the best way to control And there's really three ways. First of all, you can get away from what you're allergic to,
Mhm.
and it's more than just, okay, I'm going to move to the desert. It's how can I control those in my home? How can I reduce my exposure when I go outside? What time of the day do I need to go? And then there's medications, and some of them are prescriptions. Some of them are stuff you can buy at the drugstore. And if you know what you're doing, you can get a lot of relief just by those things. But if those two are not enough, then you go on what's called allergen immunotherapy, which is you get a test. Usually it's a skin test where they prick your skin with the different ragweed and dog dander and dust mites and mold and different things like that. And we see which ones you react to. And then we mix up a custom formula that we can then give to a person, a patient, a sufferer of allergies, once a week or sometimes more, in a shot or even in a drop that you put under your tongue, which is really cool.
Oh, yeah.
And you don't just do that, one time in the fall and one time in the spring. So it's a pretty involved deal. You come to the office every week and you get your shot. And gradually over a period of time, sometimes 3 months, sometimes a little longer, then you start to feel better and you get to where, okay, I don't need all these pills anymore. I can go outside and I don't suffer. I can still let my cat sleep with me and I don't suffer. So it can really, really help. It can also dramatically reduce the amount of sinus infections people get, which is great because some people don't even know their sinus infections are an allergy.
Wow.
You have to do allergy shots for between 3 and 5 years. And then once you get that far, then you've got sometimes lifelong immunity from these things. Sometimes it's just a remission. It comes back in 15, 20 years and you have to go start over. But
20 years. So
yeah, but 15, 20 years
of bliss.
Yes.
Wow.
Seen that over and over again. So, it's interesting because when I first started doing allergy, it wasn't really something that I aspired to. When I first got out of residency, I thought, oh, I'm going to do the big neck surgeries and the big sinus surgery, to be all sexy doctor thing, But really quickly, within about a year of being out in the real world, I figured out these patients don't get well. You can do surgery on them. It doesn't matter. They're not getting well. They need to be seen by an allergist. And I would send them off to the allergist and they would come back with a prescription for Allegra. And it's like, well, but that's not why I sent you over there. I sent you over there because I think you need allergy shots. And when the allergist and I disagreed over whether the person needed shots, I pretty quickly figured out, I need to learn to do this myself.
Right.
And so I started going to conferences, going to lots of conferences. And finally, after about a year and a half of that, I got confident enough to start up my own office. I had to leave where I was employed because they didn't want to do it. I had to leave where I was employed and open my own office. And then I started giving people allergy shots in my office. And it was amazing. And you can give allergy shots down to kids about age 4, and they do really, really well. If a child needs an allergy test, but they also need tubes in their ears, you can actually do their allergy test while they're getting their tubes, so they never even feel it.
Wow.
So that's so cool.
Yeah.
Anyway, so it's, been going on and on. I was on the faculty of an allergy society helping teach allergy to anybody who wanted to learn, which means primary care docs too. And then COVID happened. And the Allergy Society, which was a very old-fashioned
kind of
group of people.
Yeah, it had to be
old-timey group of people. They were not going to go on Zoom. And so the Allergy Society did not survive COVID. And so for a while now, I've been really wondering and worrying, okay, so what can I do to preserve this knowledge and to help more people know about allergy? And what can I do to help people get to where they can have allergy services in their office? And so I decided that I'm going to make a course
Yes.
to teach primary care docs. That means pediatricians, family medicine, internal medicine, anybody who wants to learn how to do allergy. And instead of it just being like a conference where you take notes like crazy and then you go home and you're too busy to do anything with it, I've decided that I want to give people everything they need to get started right away. And that means connections with industry reps who supply the supplies and the allergens that you need. It means resources to teach you how to get paid for doing allergy services. It means expert panelists to answer your questions when you run into a situation where you feel stuck. And just to get advice. So, I have this person, what should I do with them? So I'm super excited, and I've named my course Allergy Access for Physicians.
Yes.
And it is going live really soon. And I'm just excited as I can be about it. I just can't
wow. Wait. You know, the thing I love about like what you mentioned of all the different aspects. So it's really empowering our physicians. It's empowering our primary care docs, our pediatricians, our internal medicine, family medicine doctor. You're getting empowered with information straight from someone who's been doing this for many, many years. And the part that I really love about, the program that you're putting together is that it's not just, this is how you do it. You're supplying an ancillary information too. This is where you can get the supply from, because it's one thing to say, okay, this is how you do it. But I'm like, well, who do I get this pen from? This is how you write. Oh, this is great. Oh, writing is great. Where do I get the pen? And, so you're showing it like, you get the pen, Well,
you can't get allergy supplies at Home Depot. That's for sure.
Absolutely. Yes. And then that might have been a hindrance for someone who would love to get additional learning, because you said that their society no longer is meeting, but this is, the need is there in their patient population. So this is so wonderful that you have this, like you said, everything that you need to get started. Here's your supply. This is the list of experts. If you need questions answered, if you get stuck and you're like, well, what do I do next? So this is a wonderful, all-encompassing program that you have there for the physician, and then it's all for them, and it's so easy to remember. It's allergy access for physicians. Yeah,
exactly. So the other thing that I have is a dream. It hasn't happened yet, but is that there will be basically an ongoing membership with advanced topics every month.
Absolutely.
With a different expert to teach you something new that will help you in your practice every month. And have a Q&A session, and then also a Facebook group, so that you can go into the private group and ask questions and not worry about who's watching or who's listening or whatever. So super excited about that. There are companies that will come into a primary care doctor's office and set up allergy services for you and do everything for you and ride on your medical license. And that person might not even be an RN. And I'm not going to implicate any one company, but there are some questionable practices that some of those companies have. And so, even if you're going to use one of those companies, it's nice to be able to evaluate what they're doing exactly, so that you know what's right, what the right way to do it is that will actually help your patients, and what it ought to cost for your patients, because it can be expensive. But if it's done the right way, it can actually be economical for a patient, because say they're going to the doctor 4 or 5 times a year. If you can make it where they only need to go to the doctor once a year, you've saved them a ton of money.
Absolutely.
Even if they're still getting allergy shots, you've saved them a bunch of money. So that's what I got. I'm so excited about it.
Oh yeah, no, this is a wonderful program. And I'm pretty sure a lot of the primary cares out there, this is additional service that you can provide. And like you said, the part that I really love is that you're not just providing the service and just like, hey, do this, figure it out. You've done all the work for them, even to the point of learning, for them to learn how they can get the recompensated for all of the care that they're providing for the patient. Yes. And, you know, this is a service where the physician is adding this service to their patient, to give to their patient, and the patients will benefit because now you no longer have to suffer, and your doctor can do this right here. So you're not having to do 3 different docs. Maybe if you're a doctor in an area where you don't have these specialists, you are now
that's exactly true.
You know, to
do it exactly
there. Yeah. So this is wonderful, wonderful, wonderful. Wow. You know, so we've figured out how we are bringing all this care. So all the Allergy Access for Physician program is out there. And you physicians who are there and you're thinking, how can I expand on the care that I'm providing, this loving care that I provide to all my patients? Hey, this is one way. Yes, this is definitely one of the ways. Now, you know, we're here finding out how Dr. Gibbs is out there caring for others. You know, so not only is she there taking care of these wonderful people, ear, nose, and throat, she developed a wonderful program on allergies that she's used to help her patients, and she's used it in the Allergy Society, and now she's bringing it to all the primary care patients, right? So you're helping everybody else. Now we need to know, what do you do for yourself? How do you self-care? Yeah.
Okay, well, I, like many doctors, used to put everybody else first. Oh my goodness. I was terrible about that. And I was not sleeping well, and I was burning the candle at both ends. And I will really tell you, what really got me started was COVID, thinking, oh my gosh, I better take care of myself because nobody else is going to do it. And the first thing that I really started focusing on is sleep. And, you know, I listened to a podcast a couple years ago now, by a doctor, by a PhD, a sleep researcher. His name was Matthew Walker, and he is an amazing advocate for good quality sleep. Maybe you've heard of him. He has a book that's just wonderful and it's very readable. And so I started saying, well, I got to get to bed at the same time every night. I got to do everything that he says to make sure I don't miss sleep, which means the computer and the TV gets put away at 8 p.m. every night so that I can have a little time to unwind before sleeping. I generally take a nice hot bath and soak before bed, to get really relaxed and into the sleeping mode. And I also started lifting weights. And I will tell you, when I started lifting weights, I'm an older doc. I have to admit, I am a little older. And so I found a weightlifting program that's specifically for older folks, and it's called Starting Strength. And so 2 days a week, I go to the gym and I lift gradually heavier and heavier until I just can barely pick it up. And I do that 2 times a week, and I try not to miss at all because, you know, the trainer is there waiting for me and I'm paying his money, so I better get there.
Show up.
And it really is amazing how much better I sleep since I started doing that. 2 other things that I do that really have helped me sleep are, I got my thyroid in balance, which was harder than it sounds. It's not just take Synthroid, it's a lot more to it.
Right.
And as I went through menopause, I started taking hormone replacement therapy, and really has amazingly helped my sleep. And I do feel good when I get a great night's sleep. I feel lots of energy. I wake up without the alarm. Oh, and did I mention I gave up caffeine altogether? I had to totally, I mean, that's how bad I slept. I totally had to give it up before I really got to where I could sleep through the night.
Wow.
So that's a lot, but
Well,
that's
I
the
mean,
biggie.
but
That's what
you
I'm
did it
doing.
through gradual steps, right?
Yeah, one thing at a time. That's exactly right.
And the benefits.
That's
You said you're
exactly
waking up without your alarm, waking up before your alarm. You know, you're invigorated. You're probably doing a lot of people now. Like Dr. Gibbs, they're like, well, what caffeine did you drink? And they're like, I'm actually not drinking any caffeine.
That's right. I don't drink any. I gave it all up. I totally did.
Energized. So it really leads to the importance, like we said, self-care is so important. And one of the aspects is sleep. Sleep is something that, it's so easy for us to overlook and to put to the side. Yeah. When I interviewed one of our fellow docs, Dr. Funke,
I love
Dr. For our sleep, Restful Sleep MD. And, I said to her, sleep doesn't like me. And she says, actually, sleep loves you. It's just that, she's so quiet. And the squeaky wheel, gets
exactly.
So we do everything else. But
first. Exactly.
First. Absolutely. Yeah. So you feel so much better when you start, getting a lot of sleep. And as I love that you started your journey one step at a time. And it's so interesting. Like, as you start naming it, you're like, whoa, I did so many things.
I did so many things. And I look back on it and I'm like, did I do all that? Wow.
Yes, I get restful sleep and I'm waking up feeling great. So we know that this journey is not easy. That's what we're saying to all of you. This self-care journey isn't easy. It takes
it is not.
When you look back, you realize all the different changes that you've made in your lives and how better you're feeling along the way. Alrighty. So now that we pulled that out of you, we have one more thing. So if you weren't a doctor, what would you
Oh my gosh, what would I be? I love creative arts. I love creative. And so I love to decorate cakes, like fancy cakes. I love to design clothing. I love to build things. So I probably would have been a clothing designer or an architect if I hadn't gone into medicine.
Interesting. Guess who loves
Is that not crazy? Do you really?
I love not only Dr. Rebecca Behrens.
Oh, really?
Yes.
Wow,
Look at you,
I didn't know.
Yes. We have another designer's set right here.
That's so cool. I did not know that about her.
Yes, she loves it. So it is so awesome to hear both. Oh, so you're still using that creativity. And that's one of the I love asking that questions or that particular question, because we always find out so many additional creative side that all of our doctors. We've had some comedians, stand-up comedians, everyone who's wanted to do stand-up comedy. We've had we have one of our DJs. And then
my goodness,
had people who wanted to be professors. And then we said, sew-in journalists, travel journalists. It's just
my gosh,
on and on. Oh yeah, I love asking this question. So, and with this, we are coming full circle around to thank Dr. Gibbs, and to make sure that all of you guys are listening, find out where you can get in contact with Dr. Gibbs. I'm going to have her drop you her info. So where can they find you?
Okay, so my personal website is danagibbsmd.com, Gibbs. And my new course website is allergyaccessmd.com.
Allergyaccessmd.com. That's right. That's for all our physicians out there, our primary care physicians, Allergy Access, and she's going to give you everything you need to get started. It is all encompassing. You do not have to worry. It is right there for you, guiding you and helping you along the way, right? So I love this interview. And Dr. Gibbs, thank you so much for stopping by.
Thank you. I loved it, Tamara. This has been super good and fun too.
Alrighty. So everyone who is listening, yes, you can find this wonderful, wonderful interview wherever you do listen to your podcast. If you are on Apple, Google, Spotify, we are there. Yes. And also you'll find it on our lovely website, our Your Caring Dogs YouTube channel. That's URCARINGDOCS, Your Caring Dogs. Yes. And you'll be able to find us on our Your Caring Dogs, Dogs Who Care section on our website. So don't forget to leave Dr. Gibbs a 5-star review, because she is super awesome. Thank you so much for listening, and we will see you guys next time. Bye-bye.